Okay, so let's look at factors affecting posture and spinal curve alignment. So there are different things that affect our posture. Okay, so if we go back a bit, this is the ideal curve of the spine. Okay, but due to various elements, this can be affected. Okay, so one of the things is carrying a bag on one shoulder, and you'll find that people that do this a lot over a period of time, one shoulder becomes higher than the other. Then we have our natural environment or our lifestyle. So if you spend a lot of time at a desk or a computer, or you spend a long time driving, for example, then the top part of the spine, the thoracic, becomes pronounced, and you find that people that do this a lot, they hunch forward quite a lot. Sports and training, so if you do an excessive amount of training for the muscles in the front part of your body, for example, if you do loads and loads of sit-ups and crunches and also work the chest quite a lot, then you find that those muscles actually get shorter over a period of time, and this has effect of bringing the whole posture forward, and again people will adopt a leaning forward posture. Fashion, funnily enough, so for females that wear a lot of high heels, research has shown over a period of time that the body has to compensate to keep the body upright, because if the body was in its normal position, then it would actually lean forward quite a lot. So to actually stay upright, the body has to bend in unnatural places to compensate for the fact of wearing high heels, and this over a period of time can lead to certain muscles getting shorter and therefore making it difficult to maintain an upright, safe posture when the heels are taken off. Hereditary, so some people are born with certain spinal conditions, which we'll talk about in a bit, which again makes it difficult for them to have proper of spinal alignment. And injuries, so for example, if you twist your ankle or you stub your toe, this can affect the force that you place through your foot. So this will mean that certain muscles take over the action of, for example, walking, and they will become shorter, which will again throw your posture out of alignment. And then this becomes more important when you are performing certain exercises, because if certain muscles are compensating, which is the term compensating, for the muscles that are supposed to be providing the movement, for example jumping or running or sprinting, for example, what will happen is that these muscles that are compensating, that are stepping in, will get tighter and tighter and tighter, and over the period of time they will actually tear, and this is where muscle strains come from. So injuries are very important to make sure that we recover properly from injuries, so that our posture can be as aligned as possible, so that we can perform various movements as effectively as possible. So all of these things, these factors, can affect us having ideal posture. Finally, age. You'll see sometimes some people, as they age, the muscles in the front of their body, again, they become shorter, and this has the effect of having this hunched appearance here, okay, in the thoracic area of the spine. And again, what we need to do when you're training people of a certain age is to really work on doing what is known as thoracic extension exercises, to really get them to stand tall, to actually compensate for this happening, so that we can try and keep their posture as aligned as possible. Okay, so let's look at curvatures of the spine. Okay, so there are three main curvatures of the spine. Now in this diagram here, you can see that there is an exaggerated curve of the thoracic part of the spine, okay? And this condition is called kyphosis. Kyphosis. So as I've said here, it's an exaggerated curve which occurs in the thoracic spine and gives the appearance of a slouched posture or a hunched upper back with the head jutting or moving forwards, okay? So this is kyphosis, and as I said before in the previous slide, this is where improper training, this is where age, this is lifestyle, if you're spending a lot of time at the computer or driving, this can also lead to this spinal condition of kyphosis. You've then got lordosis. So lordosis is an exaggerated curve in the lumbar spine, and this will give the lower back a hollowed appearance and can sometimes make the buttocks appear more prominent. Okay, lordosis is a big cause of lower back pain because it's a sign that these muscles here, the muscles in the lower back, are really tight, and also the muscles in the lower abdominals, in your lower stomach, tend to be quite weak because they're not strong enough to keep the pelvis, which is here, in its natural alignment. Alright? So as well as the lower back muscles being tight, you'll also find that this muscle here, the hip flexors, or the iliopsoas, is tight. Okay? So I've already said that the lower abdominals tend to be weak, but also the buttock muscles, the gluteal muscles, tend to be weak as well. So if you want to correct lordosis, you want to try and strengthen the lower abs. You want to strengthen the glute muscles, but at the same time you want to stretch your hip flexor muscles, and you want to stretch your lower back muscles, and this will have the effect of tilting this pelvis forward, which will help cure this lower back hollowed appearance, this lordosis appearance. Okay, the final curvature of the spine that we're going to look at is scoliosis. So scoliosis is a lateral or a sideways curve of the spine, and it gives the appearance of an S shape, and you can see it here, rather than a straight line. Difficult to change with just training, and in certain cases an operation is needed to rectify it. If you were going to try and alter this via training, again you would try, and this area would probably be tight, so you'd want to stretch this area and strengthen this area with conditioning movements to try and straighten it this way. But if it's this pronounced, you are probably looking at surgery to rectify it. Okay, so before we move on, I just wanted to answer these three questions. So the first one is state 3 factors that can affect posture. Okay, and the second and third one are very similar. Okay, so describe the spinal condition kyphosis. So what area of the spine is affected, whether it's the upper, middle or lower. Which muscles are lengthened, which means which muscles are weak. So I'm not looking for specific muscles at this stage, but whether it's the front muscles, whether it's the back muscles, and the same with the muscles and shortened. And recommended exercises, I'm looking at what areas would you like to strengthen and which areas would you like to stretch. Okay, so think of the example that I gave with lordosis, which is what we're coming on to now. So what area of the spine is affected, whether it's the upper part, whether it's the middle part, or whether it's the lower part. Which muscles are lengthened or which muscles are weak, which muscles are shortened or which muscles are tight, and what areas that you would stretch and which areas would you strengthen. Once you've answered these 3 questions, then we move on. Okay, so let's look at bone types now. Okay, so there are 5 different types of bones. Now these are long, short, flat, irregular, and sesamoid. Okay, so long, short, flat, irregular, and sesamoid. Okay, so let's look at these different types of bones here. So let's see if this works.
Different types of bone.
Okay, so this diagram will show you have your long bone, and as you can see the structure here, the examples here are your humerus, radius and ulna. You have short bones, and the examples here are your carpals in your wrist and also your tarsals in your feet. You have flat bones, examples here are your cranium, you have your scapula or shoulder blades, and you have the pelvic area as well. You have irregular bones. The easiest example is the vertebra, and you've also got the bones in the jaw, the mandible, and your cheekbones, and then you've got sesamoid, which is your kneecap. Alright, so these are main examples of the different types of bones. So, long bones are greater in length than width and are slightly curved for strength. And examples here include the femur and the humerus. You've then got short bones, and they are small, cube-shaped, nearly equal in length and width. And examples are your carpals or your wrist bone, but also you've got your tarsals, which are in your feet. Then you have flat bones, and they have a large surface area that provides sites for muscle attachment. And examples include the sternum and the bones of the cranium, and also you're looking at the scapula and the pelvis. And you have irregular bones, and their name stems from their complexity and difficulty in classifying them. And the main example here is the vertebra, but you could also use your mandibles or bones in the jaw as well. Okay? So just as a learning check, on the sheet that you've got, I want you to colour in 4 different long bones, 2 regions where short bones are located, 1 sesamoid bone, 2 irregular bones, and 2 flat bones. So I want you to just pause the video and complete the activity, just to make sure that you're okay with where the different bones are and what the examples are. If you're not sure, just rewind the video a couple of minutes and go through that area again. Once you've done that, I want you to complete this table. So again, give me an example. Write down an example of or what bone type of femur is, a scapula, vertebra, carpal, radius, pelvis, and tibia.